Welcome to the Cup of Joe Show, the podcast where Senator Joseph Cryan talks about the latest in New Jersey's 20th Legislative District. This week's guest, Senior Vice President of Atlantic Health and President of Atlantic Health Overlook Medical Center, Stephanie Schwartz.
Hi, everybody, and welcome to another Cup of Joe. And today, I am absolutely honored. I don't mind telling you, Steph.
Oh, thank you.
Very, very honored to introduce our guest, Stephanie Schwartz. Stephanie is the Senior Vice President of Atlantic Healthcare and the President of Overlook Medical Center. And as we speak here, and we are in the beautiful new Arts Center here in the Township of Union, so important, and so many folks that can hear our voices today, Steph, have had the good fortune of being treated to excellent care, both through the Overlook Emergency Room here in the Township of Union and the high quality care that I know you're so proud of at Overlook. Looking forward to a conversation today about, frankly, a lot of those recent improvements that Overlook has made investments in here at the emergency room. And quite frankly, the fact that it's not just Union, right? The accessibility, I think, expands to Union, Kenilworth, and Hillside, and Roselle, and so many other communities. So let me ask you a little bit.
Sure.
Talk to us about yourself.
Thank
right?
you.
Tell us about you.
Thanks, Joe, for having me. This is just really special to be here. Thank you. And what a beautiful studio and a beautiful location. So I'm Stephanie Schwartz, and I have the best position. I get to work for Atlantic Health, which is a phenomenal healthcare system in New Jersey. I started my career 10 years ago with Atlantic Health, and I was the president at Chilton Medical Center in North Jersey, where I live. So I had the pleasure of working with that community hospital, getting to know the community, leading just a phenomenal medical center. And part of my heart is still there.
I bet it is.
Then my predecessor decided to retire, and they said, could you come over and take care of Overlook and Chilton for a little while we figure out what we're going to do. Came over to Union County. Honestly, I had never been in Union County before. Really just knew of Overlook because of being part of the health system. And I started to work there, and I fell in love with the people there and the medical staff, who's superb, and said, well, maybe I'll do this for a couple years. Here we are coming on 4 years, and have just really enjoyed the work.
So before we talk about here in Union, Overlook itself, even in the four, and I really would love if you could just take a couple minutes, and some of the accomplishments on Chilton are magnificent.
Yeah,
Can you just share that with everybody?
Sure. So both Overlook and Chilton are wonderful medical centers because they sit inside their communities. So Chilton sitting in Pompton Plains and Pequannock, and Overlook sitting in Summit. But both organizations serve the communities at large. So as a professional, I've always been in a medical center that is part of the community. And what that means is that we're taking care of people who are our family, who are our neighbors, who have grown up and raised families. Our employees are part of the medical center, in that some of them have been born in these medical centers, they've been trained in these medical centers, and then they care for the community back. So it's very special to lead an organization that is embedded in part of the fabric of the community.
It certainly is, and folks here know Overlook well, and obviously, and we'll get into that a little bit more. I do want to kind of explain to folks, though. So Atlantic Healthcare, right, is a hospital system, and there are more than a few in New Jersey. Maybe just like Morristown, obviously. Could you just explain it for a moment?
Sure. So Atlantic Health is a 8 hospital healthcare system. We also have a very large medical group that employs physicians that appear to be in practices in the community, like a private practice, but they are part of the corporation. We have visiting nurse programs. So we have a large continuum of healthcare, so that when patients come to Atlantic Health for care, whether they need tertiary care like cardiac surgery at Morristown, or they need community-based care and coming to one of our community hospitals like Overlook or Chilton or Newton or Hackettstown, the Children's Medical Center in Morristown as well, we're able to provide patients with care wherever they need it, in the offices or in the emergency room or surgery or care in our medical centers. So really proud that we link together and provide patients care wherever they need it.
So you're actually going to the patients now.
Yes, and our practices are available throughout all of our communities, and those physicians lean back into the hospitals for when they need to admit patients. We have superb medical staff that are in the hospitals, like intensivists that take care of patients in the critical care units, hospitalists that take care of patients when they're admitted, and then we bring those patients back out to their primary care doctors in the community. So a real continuum of care.
Yeah, I have to say, and obviously I'm a fan from being a consumer of the quality of Atlantic Health, but so are so many. It does feel, this may be an off-the-wall question, but it almost feels as if there's a customer service level to it, that people, I will tell you, nurses are more responsive. I don't want to, but they're more responsive. They're there. As somebody in elected office, I hear about a continuum of care. It seems as if there's a philosophy about patients.
There really is. We want people to trust us. These are the most vulnerable times for people, whether you're having a wonderful event like having a beautiful new baby, or you're having surgery, or you've been diagnosed with something that is going to be challenging. We need people to trust us. And so that level of responsiveness and that level of care is really what Atlantic Health provides. And it's consistent across our organization. It's part of the culture, and really caring for people close to home. And that's important as well. We don't need to travel for healthcare. Sometimes if we have a very unusual diagnosis or we need a particular specialist, we all travel. But there's a lot of care that can be delivered close to home, and that's important for people.
It sure is. So speaking of close to home, let me transition over to the emergency room and all the investment that's happened. And frankly, I just really want to leave it to you to talk about just those incredibly significant changes that have been made, frankly, with your leadership. And I was hopeful you could brag on that for a while.
Sure. So the renovation at our Union Emergency Department was something, it's been a passion project for me. When I came out to Union County and they said, let's go visit the Union Emergency Department, I saw a facility that had really great care, really committed team members and physicians, but a facility that was really sad. The health system that had been running a medical center at that location decided to close the medical center. And in 2007, Atlantic Health said, we can't abandon the emergency department here. People need emergency care. They need care close to home. So Atlantic Health System took over the emergency department. But I think that's where it stopped. I don't think we ever came back and renovated the space or looked at it. And the emergency departments get a lot of wear and tear. We see 80 to 100 patients in that space a day. So the space was starting to look sad, and it certainly didn't match the kind of care that was being delivered there. So we worked on a project and demonstrated that our commitment is to Union County, and that is an important location at that 5 points. A lot of people live around that community, very accessible. So we were able to support a project with support throughout the community of about $6.4 million to renovate that emergency department. I'm really proud, and we just ribbon cutted. You helped us do that. You helped us cut that ribbon and open those doors again. Actually, we stayed open the whole time we were renovating. And very proud of now that the physical space matches the exceptional care that's happening there.
Can we talk about that a little more? Because I believe the folks that can hear our voice are familiar with it. You and I have chatted about this in 2007, I think, and I know it predates you, but I believe that the expectation or the definition of success might be about 5,000 visits a year. You just mentioned 80 to 100 folks a day. That equates to somewhere around 36,000.
Exactly.
That's
a lot.
Stunning. Yes.
Imagine if those folks that were coming to that emergency department, if we weren't there, they'd have to get in the car, they'd have to hit a major road to get to a medical center. There would be time between the time they left their homes and got to a major medical center in another community. And we're able to take care of those 80 to 100 people. A lot of them are kids. Sometimes we see 20, 25 kids in a day who need emergency care, whether that's an ear infection, child's been up all night, somebody's, may break something. So we're there. And the number of people that leave the Union Emergency Department on a daily basis that need a higher level of care that we bring to Summit or to Morristown is somewhere between 1 and 3 patients. So a lot of that care gets delivered right there in the community, and people get to go back home and be with their families, which is really important. But for those patients that do come to Union Emergency Department and need a higher level of care, somebody having a stroke, somebody who's having a cardiac event, a heart attack, we're able to put them in an ambulance and get them to Summit or get them to Morristown in a short period, which allows them to get elevated care.
So which is a comfort level for the communities I mentioned in the opening, and obviously right here in the township of Union, it's significant. It's close by, and it's easy to get to. But when you talk about 1 to 3 going on for the next need, that means the vast majority are their thing is there, as you mentioned.
Exactly.
And yet you've renovated almost, I think, more than 10,000 square feet.
Absolutely.
And can you tell folks, because who've been there previously, and nobody wants to be there,
That's
but
right.
again, that comfort level.
Yes.
So come on, let's talk about it.
So when we renovated the 10,000 square feet in that emergency department, we didn't move any walls because it's not it's a building that's got a nice footprint, and the emergency room is set in place. But we did bring modern technology into the space. We increased the privacy. It was an old emergency department that had a lot of curtains between patients. When you're not feeling well, nobody really wants to be right next to their neighbor. So we created walls between spaces. We added rooms. So we've got 23 rooms now. We have an MRI, a CAT scan, a full x-ray department. So when you come there, you get all your tests. We have a laboratory there. You get everything done. We diagnose you, and then we decide whether you need to come to Summit. So we're able to take care of patients right there. So high tech, privacy. It looks beautiful, modern, and that's also important for our team members who work really hard. Our physicians, our radiology techs, our nurses. They're able to work in an environment that matches the kind of care that they provide.
Well, it's welcoming even when you come in now, as opposed to, I'll just say, a little tired.
It was very tired. Even the lobby looks better. So the entrance is more welcoming. We were able to triage people in a private space instead of talking to you at the desk about why you might be showing up at an emergency department. All the things that people want when you're not feeling your best.
Yeah. I admit, having sat in that room a couple times, you could hear folks talking about. And I think I shared this with you offline. I have these 2 guys that were waiting for their mother to get care, and we were in this tired waiting room. And now it's just so incredible.
It says we've got you. We're going to take care of you. We've got you. You're not feeling well. Your family members in a situation, and we've got your back. We're going to take care of you. Have confidence in us. Trust us. And look at the exceptional people that we have. Our physicians, our nurses, our technicians. We're here to take care of you.
And I do want to talk about them a little bit more, because I do think it's so important for folks. But I have to say, again, having had the opportunity to utilize, nobody wants to be there, but when you are, the idea of the walls, I have to tell you, as opposed to the curtains.
Yeah.
If you can hear my voice and you've been there, you know what I'm talking about. The change, besides the color scheme, the lighting, just that comfort level of, look, let's face it, nobody's thrilled about, and it really is. It's just incredibly dramatic.
It's really important.
Talk to me a little bit more about like the nurses' stations, all those things that matter in these visits. Can you just expand upon it?
Sure. So the team that is there includes, as we've talked about, our physicians, our nurses, our technicians. We've given them spaces where their technology is able to be comfortable. We use an electronic health record throughout Atlantic Health System. So when you're at the Union Emergency Department and there's an emergency room record, then your primary care doctor is able to see your care. Your specialists are able to see your care. So the computers now fit at the nurse's station. They're not in front. When you walk up, they're positioned so that the team member can still talk to a visitor or a patient. Our technology fits. We have all the right plugs and all the right support to support our technology. We've also built into the space locations where carts and other technology fit into the wall, so they're not standing in the middle of the hallway. It's intimidating when you're not feeling well to have all that technology around. So we've tried to be respectful of how people feel when they're in the emergency department, but yet still allow our team members to have access to the tools that they need to care for patients.
It's incredibly well thought out.
We worked hard on that. We got input from our team, which is important. They're the ones that live in the space.
So talk to me about the team a little more. The physicians that are there. You touched upon it, But I don't think folks realize the high quality and caliber of the
Yeah.
folks that are. Can we
Sure.
brag on that a little bit more?
Absolutely. I love our medical staffs at Atlantic Health. Very high quality. Our emergency room physicians, we have several that are there depending upon the shift. So you'll see a provider when you come to the Union Emergency Department. So great board certified emergency room physicians, also physicians that take care of kids. So that's why I think we're a popular place to bring a little person who may not be feeling well. So we've got a great medical staff, and then you pair them with a group of nurses. Our nurses at Union Emergency Department have received a certification from the Emergency Nurses Association called Lantern. They are the only emergency room across the world, internationally, that have received this recognition for
Really?
15 straight years. And it's a level of certification that says we have standards that are high for our nurses, that are high for the care that we provide, and it's a quality care. So really proud of this nursing team and their Lantern designations.
Wow.
Yeah.
That's quite a.
And then we have radiology techs who are phenomenal, MRI techs, laboratorians who are able to run tests, all happening right at this facility. Respiratory therapists, especially this time of year where people are having the flu or RSV or not feeling so great from a respiratory perspective. We have a respiratory therapist that's there that's able to provide treatments so that you don't have to go to Summit ED to receive those kinds of treatments.
And I'm a little repetitive here, but I will tell
Yeah.
you, having had a couple lab tests there, again, you're vulnerable.
Right.
You're not really comfortable, and those folks make you
Absolutely.
feel comfortable, in a difficult situation. That's some trick to do, and
Yeah.
they do it. They make it look easy.
They do. They work really hard and they care about the community.
So it's outpatient. It's also physical therapy. There's
Yep.
a whole quite a variety of tasks that are done here. Correct?
Absolutely. So besides the care that's provided in our emergency department, that building, which used to be an old hospital, Atlantic Health has placed other services within that building. So we have primary care doctors there, we have specialists there, we have a physical therapy location, a whole imaging department that's not just used for emergency rooms. So if you need to have an MRI, you can make an appointment for an outpatient MRI at that location. You can make an appointment for a chest x-ray. So we have taken quite a bit of space in that building that used to be a hospital for ambulatory or outpatient healthcare as well, not just the emergency department.
And yet you're able, and to mention, you mentioned the electronic records
Yes.
earlier. So if you're within the Atlantic system, for example, even though you're doing that MRI on a
That's right.
scheduled outpatient, that continuum, it's on the my chart, so
That's
to
right,
speak, right?
exactly. I have it on your phone.
Right. And folks can actually see that and
That's
get those results and really be able to talk to their physicians or nurses in an educated way.
Yeah, it allows us to tie the care together so that this is an episodic. It's known to the rest of your providers. So the Epic chart, the My chart, allows that to happen.
Absolutely. So talk to me. So you provided, clearly we have the latest of technologies now, right? We have the best of care that we can possibly get right here in the area. And along with the high quality Atlantic healthcare standards at Overlook and beyond. So, but talk to me about the community impact, right? And I know Atlantic's got a thing, and I know please share some thoughts.
So, my philosophy is really that care needs to be close to home. And by being in a location like the Union facility, we're able to do that. But we're able to provide the level of care that people need when they are having a major healthcare event. So, for example, if someone's having a stroke, they've woken up and things don't look quite right, they're able to come to the Union Emergency Department. We have technology that allows us to bring a neurologist into that space electronically through what's called telestroke. We're able to provide that care locally. And if that patient is having a stroke and needs more advanced care, we're then able to bring them over to Summit. So, but the care is local. It's right in their neighborhood. And I think that's really important with people who live in that community, who feel strongly and positively about the health of the community. Care can't be delivered outside of the community and be consistent. We're really consistent when we're able to be right at home. If you need something special, if we need cardiac surgery, yes, that's important to travel for those types of care. But the basic care, the basic primary care, emergency room care can happen in our communities.
At the opening, I was talking to the head physician, and he was actually talking about strokes and heart
Yes.
attacks, how folks come in and they're fearful or they don't know.
That's right.
Which is also the other part of it, and how important that this was. And it's you mentioned the children, the amount of children. He said, but it's an ongoing thing.
Dr. Goodman's
Yes,
a great
great
example.
guy.
So Dr. Goodman is Elliot Goodman is our medical director at the Union facility. He actually did his internship. So when he was a young physician, he did his internship at the Union Emergency Department when it was part of a hospital. And now he's back. He cares about the community. And he's able to provide that level of care. So if someone's having a heart attack or a stroke, he feels confident that he can provide that exceptional care there, but also lean into the care that's provided at the Neuroscience Institute at Overlook. So it's beautiful to see that commitment to being able to provide exceptional care and to make people better. I mean, time today for providing exceptional care, a stroke patient needs to get oxygenation and blood to their brain to be able to come out of that stroke in a positive way. And so having immediate diagnosis and then care that's exceptional is really important to their well-being post the stroke. Same thing with a heart attack.
It's absolutely amazing, and the changes in the technology.
Yeah.
You know, a lot of people that hear our voice there were born in Union Hospital.
There you go.
Right?
So a lot of people know.
And now they can, if they haven't heard
That's right.
they know now that continuum of care is
Yeah.
even decades later is still there.
I think that's what's special. This idea that people were born at Union Hospital or born at Overlook or born at Chilton. How beautiful that we're still able to provide sophisticated care in those facilities where people have had their families. And a lot of people will tell us, I was born here and my daughter was born here and my mother was born, and we have families at our facilities. And that's what's, I think, really special about providing community health care.
It's got to be a real source of pride.
It is. It's very, very special. Like I say, I have the best job. I have the honor of coming in and working with these super smart people who are able to use their hands and their brains and make people better. And what could be better than that?
Well, yeah, I think you create a culture that helps.
Thank you.
Helps people thrive, and most importantly, helps people be healthy.
That's right, and that's why we're here. We know people have moments where they need emergency care or need more sophisticated care, but we really want people to be healthy.
Well, it has been an absolute pleasure.
Thank you.
Stephanie, thanks so much for sharing a few minutes with us. Folks that can hear our voice understand that we've had the great honor of speaking with Stephanie Schwartz, the president of Overlook, and a variety of other titles, but most importantly, leader of one of the finest healthcare organizations in not only in the state of New Jersey, but in our country. And we appreciate your investment right here in Union.
Thank you, Joe. It's been a pleasure to have coffee with you this morning. Thank you.
It's been a pleasure. Thanks so much.
Thank you.
That's a wrap on this episode of A Cup of Joe, hosted by Senator Joseph Cryan.